Hello everyone, bonjour tout le monde. Au cours des dernières semaines, des membres des forces armées sont allés.
The Canadian Armed Forces have provided assistance to long-term care assistance and old age homes in Quebec and Ontario. Ontario and Quebec asked us to extend the Army's mission, and as I said yesterday, our government is discussing the matter with these two governments. The Canadian Forces members are doing extraordinary work to help our grandparents, our parents, and other elders during this crisis, and I'd like to thank them. It's far from being an easy job and an easy situation. This morning, the government of Quebec published the report produced by the Canadian Forces member who raised several concerning issues. Several observations in the report, like the lack of personnel, are amongst the reasons for which Premier Legault asked for the assistance of the Canadian Forces a month and a half ago. These are serious issues that needed to be brought to the attention both of Quebec, and we therefore sent them the report last night. I also spoke to Premier Legault earlier this morning, and I repeated our support. Tomorrow night, during our telephone conversation, I will discuss the conditions in our long-term care facilities during my weekly telephone call with premiers of the provinces and territories.
I plan on raising what's happening in nursing homes and long-term care facilities with the premiers during our weekly call. I will once again offer our government's support as they try to get the situation under control. As I've said many times, we need to do a better job of caring for seniors. They raised us, they built this country, they deserve better. During the first few weeks of the crisis, people's lives were turned upside down. Hundreds of thousands of Canadians lost their job through no fault of their own, without warning, because of this pandemic. It put enormous financial pressure on everyone from students to young professionals to families. So, we brought in the Canada Emergency Response Benefit to support people until they're able to get back to work. And to help as many Canadians as possible keep their jobs or get hired, we introduced the Canada Emergency Wage Subsidy. We also unveiled our $9 billion plan to help students and recent grads get through the next few months. We now have over 45,000 jobs available for young people. If you or someone you know is interested, go to jobbank.ca to apply. Now, as provinces and territories restart some activities and many people head back to work, fewer people will need the help of the CERB. But the wage subsidy will continue to be there to support Canadians and make sure they can get paid their salaries. Maintaining the connection between employer and employee is key not just to helping people get back on their feet, but to keeping our economy strong. That's why it's so important that employers take advantage of this program and rehire workers. Au cours des premières semaines de la crise, la vie de beaucoup
During
de
the
gens
first weeks in the crisis, the lives of many were changed, and many thousands of people lost their lives to the pandemic. This produced a lot of pressure on families, young professionals, students, and many more. We therefore set up the Canadian Emergency Benefit to support people until they could return to work and to allow the largest number of people possible to keep their job or be hired. We set up the emergency wage subsidy. We also set up a $9 billion plan to help students get through the next few months. More than 45,000 jobs for students have been posted on the government's website. In order to seek such a job, go to the website. We're starting to reopen some activities in all of the provinces and territories, and this means that people will have less and less need for the emergency benefit. The wage subsidy will remain in order to help people during the reopening phase and ensure that employees be properly paid. Maintaining the link between employer and employee will also help support the strength of the economy. If you are a business owner and you have not made a request, I invite you to go to the Revenue Canada website to do so. I've been saying it from the beginning. In order to get out of this crisis, everybody has to do their share. In order to save lives, people have to continue to practice physical distancing. to relaunch the economy, people have to get to work, and businesses and merchants have to have clients. Therefore, if you're an employer, rehire your employees. Our government can help you and will help you. I'm therefore ready to answer your questions now. Thank you, Premier. Let's move on to questions from the telephone operator. First question, Marie Vestel, Le Devoir. Good morning, Mr. Trudeau. On these reports from in Ontario and Quebec on produced by the military and the long-term care facilities, I know you've offered to help the provinces. You said several times that you would respect the provincial jurisdiction over health, but you also said that you would help provinces. Now, what are you thinking of doing? Is it what former Liberal government did, and that's transfer specific amounts of money to the provinces so that those monies go precisely to these long-term care facilities? Answer. These are discussions that we have to have and will be having between myself and the premiers. Our first priority is to ensure that the assistance that was needed now to support the system, whether it be by the presence of members of the military or other means, be there. Therefore, we're working now to help out the long-term care facilities as much as possible in coordination with provinces, but indeed, for the long term, as to how we have to move forward as a country and properly take care of our seniors even after the pandemic, we'll be there to discuss the matter with them.
Obviously, we need to make sure that in Canada there is a better job of supporting our seniors, particularly in long-term care centres. That's why we are there to help, and we've offered to help with the provinces. We will, of course, always respect provincial jurisdictions, but we will be part of those conversations. In the immediate, we need to make sure that help is improving, that help is getting to people who need it and to centres who need it. That's why we're there with the military and why we're looking at other ways of helping in the short term as well. But for the longer term conversations, well, those need to be had, because coming out of this pandemic and into the future, we need to make sure we're doing a better job of supporting our seniors, and the federal government is there to work with the provinces while respecting their jurisdiction.
En suivi, Marie?
Merci.
Follow-up question, yes. You say that you want to respect provincial jurisdiction, but would are provinces open to receiving transfer with conditions attached as to where it is spent? And on the emergency benefit, you've also asked a lot of people to move from that to the wage subsidy, but are you going to extend the PCU, the emergency benefit to date? Like you've done so for the salaries, which I've answered earlier, we're going to continue our discussions with provinces. I believe that all governments, including municipal and Indigenous governments, receive pressure from their constituents to improve services to our elders. And, of course, we'll have to listen to the concerns of Canadians who wish us to work together to improve the system. Well, I can't answer for what provinces want to do for now. Now, with regard to the programs, it will be important to end the programs that we have in a reasonable and responsible way. We had to support people by providing some money to help us get through this crisis period in the best way possible, and that is what we've done. But obviously, the way that we will move back to an economy that is now reopening with employers who open up their businesses, hire and rehire their employees, well, we'll look at the best ways of ending the support programs we're discussing right now with other levels of government and unions and business groups about that matter.
Gradual reopening of our economy will require a phasing out or an ending of certain programs and a continuation or modification of others. And those are things we're looking very carefully at. We are still very much in the emergency phase, in the crisis phase of this, even as we're seeing careful reopenings. We need to make sure we are continuing to protect vulnerable Canadians and ensure that we're controlling and stopping the spread of COVID-19. We will, however, look very carefully at how we end certain programs, how we modify others in order to get our economy going again to where it was before or even better.
Thank you. Operator, next question.
Thank you. Merci. The next question, Cormac McSweeney, CB News Rogers Radio. Line open.
Yes, Prime Minister, I'm just wondering that given that advocates have said that the problems with long-term care are not new and they are widespread across the country, and that you yourself have said that it's not limited to the facilities that the military is currently deployed in, is it time for a national inquiry into long-term care facilities in Canada?
I think right now, while we're in this crisis, our responsibility is to respond to this crisis as best we can and to ensure that we are improving in the COVID context care as best we can. But absolutely, we need to have conversations about how we care for our elders in this country, right across the country, and respecting provincial jurisdiction, respecting that there are areas that have greater success and fewer problems than others, means that we will need to be very careful and very grounded in the facts on the ground as we look to moving forward.
And I have a question.
Nous savons tous que oui, il y a des défis dans nos centres.
We all know that there are challenges in our long-term care facilities, but there's a lot of differences between provinces and even within a province. We will be working to provide immediate help during the crisis, but obviously discussions and a careful look at what we can do better are both essential to help us move forward properly.
From a colleague at 680 News in Toronto. I'm just wondering, New Zealand has floated the idea about a 4-day work week and extra statutory holidays post the COVID-19 pandemic to try and boost the economy. I'm wondering if you would consider the same thing for Canada, if that's something that you think would work for our country.
I think there are a lot of people thinking creatively about what the post-COVID world could look like, and I look forward to hearing a wide range of suggestions. But right now, we're very much focused on getting through this particular crisis, and we'll have plenty of time to talk about particularly creative ideas on moving forward, but I'm not going to speculate on what any of them might be.
Merci. Opérateur, prochaine question.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse.
Mélanie Marquis, La Presse. Good morning, Mr. Trudeau. I'd like to come back to the report of the Army on the long-term care facilities. Have you read it? And what do you think of it? What are the lessons that you draw from it? Answer, yes, I did. I read it completely last evening. There's some concerning observations there, the lack of personnel, the difficulty of having the hot and cold zones being respected properly, but everything that is there are pointed out as reasons for which we needed the armed forces in the first place. And I must say that from what I read last night, I felt great pride in the professionalism and capabilities of our armed forces personnel that are there to help out in systems that are in difficulty. They're there to help protect vulnerable Canadians. There are some troubling points raised in the report, but we see that we did need to be there to support each other and that we need to bring certain improvements in the operation of these centres.
In its entirety in regards to Quebec. Obviously, there are many things that were troubling that highlighted the very need that we had to send in our armed forces to help, whether it was lack of personnel or difficulty in following the strict separation and isolation and PPE rules. There was a need for our Canadian Armed Forces, and it certainly filled me with a tremendous amount of pride and even deeper respect for the professionals in our armed forces who to have made such a positive difference in a short amount of time in some systems that were really in need of extra assistance. Obviously, there are difficult things that we need to continue on, but we've seen significant improvement in many of those centres, and there continues to be a need for us to work together, and I certainly spoke about that this morning with Premier Legault in our conversation.
En suivi, Mélanie?
Follow-up question, Mélanie, yes. On another unrelated matter, an important decision will be handed down today in the Supreme Court of British Columbia. If the court rules favorably to Meng Wanzhou, the chief financial officer of Huawei, what will Canada do? We're just a few hours off the publication of this judgment, and we will wait to hear it before we speculate on our future decisions in that.
Thank you. Merci. Next question, Teresa Wright, The Canadian Press, line open.
Good morning, Prime Minister. Experts and advocates who have been raising red flags about the long-term care system for years are calling for immediate federal leadership, including national standards and guidelines. What is your immediate plan to deal with these systemic issues at the federal level now that the military has confirmed what many people have known for years?
Well, the immediate plan is to help out immediately. That's what we're doing with the military. That's why we're working very closely with the provinces on looking at how we can ensure that they have the resources needed to get these care centres properly serving the elders who they care for. There are many things that we need to work on right now. But of course, there will be many important discussions going forward on how we establish a better system in Canada. And I'm not going to, short-circuit that conversation by putting forward aggressive proposals right now. But all I will say is the federal government is there to support and to work with provinces to ensure that in areas of their jurisdiction, they are able to give Canadians the care that they and their families expect.
What we need to do immediately is ensure that during this pandemic crisis, we have the necessary resources to take care of our seniors throughout the country. The federal government will be there to be a partner along with the provinces as they maintain control over these systems. Obviously, in the long term, we must have and will have long conversations how to ensure to have a better system to help Canadians and ensure to families that their elders are being properly taken care of, and we will be there for those conversations also. But we will have them touching on the future, and they will be held at the appropriate moment in time.
Prime Minister, your government is currently engaged in an unprecedented peacetime expansion of government spending and powers. At some point, shouldn't Canadians be allowed a vote on the choices you are making and given the opportunity to say in a democratic fashion whether that's the path they want this country on?
I haven't heard a lot of Canadians demanding an election right now, but obviously in a minority parliament, Parliament gets to decide when it no longer has confidence in the government. And certainly the focus we have moving forward is trying to respond to help Canadians as best we can in the immediate. This is a time of a certain crisis for Canadians, and that's why we have made unprecedented investments to support Canadians to get through this challenge. But there will be many challenges that we will face over the coming years as to how we improve the Canadian economy, how we make better digital changes, how we move forward on a greener and cleaner economy, how we support our most vulnerable in better ways. And there will be many debates in Parliament and eventually in an election. But I'm not going to speculate on when that might be. Okay. Je pense que les Canadiens savent que notre gouvernement...
I think Canadians know that our government is there to help those who are in need right now. We have to do everything we can right now to get through this COVID crisis quickly, in order to reset our economy and the functioning of society. Obviously, there will be times to think about the long term and how to apply the lessons of the pandemic, protecting our vulnerable people, how to build a better digital society, a greener society. There's all kinds of discussions that have to be held among Canadians and political debates, and eventually elections will also be part of it. Now, obviously, with regard to the elections, right now we're in a minority situation, so Parliament will decide when they no longer have confidence in my government and that they want to move on and have elections. But for now, I will continue to govern for all Canadians.
Mr. Cuslow with Global News. What do you think of the particular part of the military's report on Quebec long-term care homes that states they were keeping residents who tested positive for COVID-19 in rooms with those who tested negative?
Obviously, the report highlights a number of preoccupying issues, and the military has acted with tremendous professionalism, not just in writing a report and sharing it, but on acting on the ground with administration of the centres, with partners to ensure that procedures are improved. We are extraordinarily lucky to have the amazing professionals in the military who are helping out and protecting Canadians, but this is what they do. They take risks and they keep Canadians safe, and we are lucky to have them.
And what specifically will the federal government do to support the provinces in overhauling the system, ensuring proper staffing and accountability to stop this from happening in the future?
Obviously, we need to do things right now, and we are doing things now to ensure that elders across the country get the care they need in this COVID crisis. But there will be a need for much longer conversations about how we move forward, and we ensure that right across the country, all of our elders who contributed so much, who built this country, get the proper care that they so richly deserve.
Bonjour, M. Trudeau. Louis Blouin de Radio-Canada.
Mr. Trudeau, Louis Blouin, CBC, on federal national inquiry. I'd like to more precise answer. Is this part of the options that you're looking at, and where would be the ground for the federal government in order not to interfere with provincial jurisdiction? Where do you think you could conduct an inquiry without it representing something that would interfere with provincial jurisdictions? Answer. What we've seen in the two reports we receive in Ontario, Quebec, is that there, despite the differences from one province to the other, there are some provinces that have different challenges than others. But I think that, first off, I heard Mr. Ford, and Mr. Legault will speak out later, on their point of view on the reports they received and what they want to do. We will be there to support provinces in their plans and to participate as much as possible and according to the needs. I'm not taking anything off the table, but at the same time, I will respect provincial jurisdiction, and we will be there to support the provinces as they try to regain control over their system.
Need to work together to move forward and ensure that our elders are getting the proper care. But the situation does vary across the country from region to region, from province to province, and we respect the provincial responsibility to get these situations under control. But like I said, we will be there to help in ways that we're needed to do. If there is a need for greater federal leadership, we will certainly respond to those requests. At the same time, everything is on the table as we move forward. We know Canadians expect us to do better by our elders, all of us, and all orders of government, and we will ensure that we do.
Je vais vous poser une question sur les travaux parlementaires.
I'd like to ask you a question on the work in the House. The opposition accused you of lacking transparency. Even yesterday, the parliamentary budget officer said that 4 hours is not really very much to study all the federal aid programs in the House. Is it the right time to limit debates in the House when Ottawa is at a historical level of spending? Answer, on the opposite. We have increased significantly. We doubled, in fact, the time allotted each week to a question period in the House. Not only on COVID, but on all kinds of topics. It's important that during a crisis, we have a functional House, we have democratic institutions doing their work, and we will continue to be open and transparent. And the Parliament decided that going forward with a hybrid approach, which I am looking forward to this afternoon, which will allow members in the House to ask questions, but also members from far away to ensure that the concerns of their citizens are heard. I think this is a very positive measure for the country to ensure the proper working of our democracy during this crisis period.
That we continue to have a well-functioning parliament and functioning democratic institutions during this crisis. Over the past weeks, we've been sitting 3 times a week, twice virtually, once in person. But going forward, we will now sit 4 times a week, and there will be more than double the usual time for questions from MPs. And MPs not just in the House, but MPs right across the country. With the virtual parliament we're moving, hybrid parliament we're moving forward with, MPs who represent far-off places in this country who aren't able to come physically to Ottawa will still be able to ask the questions that their constituents expect them to. This is a way of demonstrating that we are moving forward on upholding our democratic principles and our institutions, not in spite of a crisis, but because of this crisis.
Hi, Prime Minister. Tom Perry, CBC. You're going to be talking to the premiers about the situation in long-term care facilities. Would you be prepared to increase Canada Health transfers to the provinces and territories with that money going toward these facilities to improve the situation there?
We've already increased the Canada Health transfers. We transferred $500 million to the provinces at the beginning of this pandemic to help out with the extra costs we knew that were coming. Our focus right now is on making sure that we're doing everything we can right now to help during this particular situation. But of course, going forward, Canadians want to see us doing better by our elders right across the country, even beyond this pandemic. And we're going to be there to work with the provinces on the right way to move forward. Okay. Nous avons augmenté les transferts
We increased the health transfers to provinces by some $500 million that we sent at the beginning of the pandemic so the provinces could answer to the needs associated with the COVID-19 pandemic. We'll continue to be there in the short term to help them in various different ways. But for the mid to long term, we'll be there for the discussions that must be held on how better help our seniors throughout the country.
I've asked you to extend the military mission to the long-term care facilities. Given what the military has uncovered in some of these places, how long do you think they're going to have to be there, and what conditions would you want to see before you pulled them out?
Well, I think we definitely need to see situations improved. As we saw in the Quebec report, there are significant improvements over the past weeks in those situations, and in a number of them, the military is ready to pull out or move on from those particular instances. I think the discussions that we're having with the provinces right now is really about how we will move beyond the need for military support, how they will get their systems back under control without a need for federal intervention of having soldiers in our seniors care centres. We are happy to be there, and it is extremely important, obviously, that we be there during this crisis. But it's not a long-term solution, and we need to make sure that we're working carefully with the provinces to ensure that they are able to solve for this problem for the medium and long term, and we will work with them on that.
I think we all understand that having soldiers in our long-term care facilities is not a solution for the mid to long term. It's only a short-term solution. We're very happy to have them there now, and I think these reports indicate how important it was to have them sent there, and we will continue to be present. But also, I think we have to have a discussion with the provinces about how we will go over and beyond this urgent situation of military assistance so that they can regain control of their own systems in an appropriate fashion. I think we all recognize that soldiers in this kind of a situation, well, we're very lucky to have them, but it's not a long-term solution.
Wood, CTV News. Prime Minister, I just want to revisit the question of immediate steps that your government is going to take with regard to long-term care homes. You've mentioned the military being there already and phone calls with the premiers. Doug Ford's asking for more financial support. Is it simply a question of money for you?
It's a question of making sure that our elders are well taken care of right across the country. This is something that matters deeply to Canadians, and it's something that we will ensure that happens. We're working with the provinces right now on making sure they have the resources necessary to serve our seniors in the right way. But of course, as we move forward, we will need to continue talking about this and figure out more longer-term solutions.
President Trump is keen on holding an in-person G7 meeting. Is that a good idea from a public health standpoint, in your opinion? And are you going to attend?
It's not a question of my opinion on public health standpoints. We are going to be discussing with public health public health experts, and discussing with the U.S. administration what their plans are and how they're responding to questions around transmission, questions around would we then as leaders have to isolate when we return, which is right now the rule in Canada. There are significant health preoccupations that we have around holding an in-person meeting, but there's no question that in-person meetings in an ideal situation are much more effective than even virtual meetings. However, there are many questions to answer before we can commit to showing up in person, and those discussions are happening in an ongoing and very constructive way. With
and if he pushes ahead with an in-person meeting, will you attend?
We will continue our discussions with the Americans, and we will abide by public health recommendations. Évidemment, nous allons toujours rester.
Obviously, we will always respect the recommendations of public health. And about a G7 meeting in person, we'll look at the American proposal. We're working with them to see what our responsibilities and obligations would be and how they intend to set it up. For example, coming back to Canada, if we have to have a 2-week quarantine, as is the case now for anyone entering the country, that's an issue. So we'll have to look at all of these factors. Now, G7 meeting is an important event. It's always better to have an in-person event than a virtual event, but there are public health considerations that we absolutely must take into account, and that's why discussions are continuing. And that's it for today's press conference. Thank you.
Hello.
$1,939 cases in Canada, including 6,671 deaths and 45,766, of which 53% have now recovered. Labs across Canada have tested over 1.5 million people for COVID-19 up to date, with about 5% of these testing positive overall. Over the past week, we have been testing an average of 22,300 people daily. Bonjour tout le monde.
Good afternoon, everyone. Rather than doing her usual media press scrum, the Chief Public Health Officer has released the following statement today. On this Wednesday, the 27th of May, there are now 86,939 cases, including 6,671 deaths, and 45,766, or 53%, having now recovered. To date, labs across Canada have tested over 1,528,000 persons for COVID-19, with about 5% of these tests positive overall. And over the last week, we have been testing an average of 22,300 people daily.
Dr. Tam would also like to remind people to exercise caution when dealing with extreme heat this summer. It can affect how the body regulates its core temperature and can result in heat illnesses. Yesterday, the Canadian Armed Forces report on long-term care homes in Ontario was made public. It was a deeply disturbing and heart-wrenching report. And I think that all Canadians share the Prime Minister's view that things must change. Our seniors deserve better. And as a society, we can and we should and we must do better.
Today, the Quebec government released the Canadian Armed Forces report on the situation of the long-term care facilities where the Canadian Armed Forces were deployed. It's a damning report, heart-wrenching, and I think that all Canadians and certainly all Quebecers realise that we need to have a serious conversation about how we treat our seniors and have this conversation as a society as a whole. With a bit of luck, we'll all reach this golden age, and we should be entitled to, well, since we now are entitled to die in dignity, we should, of course, be able to live in dignity. I'd be delighted now to respond to your questions.
Thank you, Minister. So today we're going to start in the room to let people time to queue up. So Ian, Julie, Mike, who goes first? Julie?
Oh. Okay. Monsieur Duclos, we after hearing the information about the reports both yesterday and today, there's a lot of suggestions out there, but the Prime Minister keeps talking about respecting provincial jurisdiction. Is putting long-term care under the Canada Health Act, is that completely off the table?
Well, Julie, as you said, these are very, very difficult reports to read through. I did also read through the Ontario report yesterday and the Quebec report this morning. This is very difficult to not only to take note of, but certainly to accept in Canada, a developed economy, a developed society, where we absolutely need to take better care of our seniors. And that's why, as the Prime Minister repeatedly said this morning, we need to have a very serious and collaborative discussion on how we look after our seniors in the weeks, the months, and the years to come. He also said that this conversation opens up all options, as we must and as we should do, and therefore we will have to work together and speak respectfully of each other's jurisdictions, but also work respectfully with each other to make sure that our seniors get better care.
Okay, so that doesn't sound like it is off the table. So, second question. You're, as you know, Revera is the second largest private chain in the country, which is under the Crown Corporation that reports to you. The federal cabinet also appoints an auditor to Revera, a financial auditor. And I'm wondering, because of all the problems that exist in long-term care homes, including those ones, are you considering appointing a health auditor who would make sure that quality of care was underway?
Well, your question is extremely relevant, given the reports we've received yesterday and today, which remind us again of the importance to acknowledge the very difficult circumstances in which too many of our seniors have been going through in the last few weeks. But that also speaks to the difficult circumstances in which many of them were finding themselves prior to the crisis. Those circumstances perhaps were slightly less serious because of the absence of COVID-19, and they might have been visible because, unfortunately, the lives of these seniors are often hidden from the media and public view, and therefore that calls upon the government, as I said just a few moments ago, to look at all options. Regarding Revera and the Public Sector Pension Investment Board, PSP, as we call it, is an independent organization. It's an arm's-length organization with two layers of independence. First layer is at the appointment committee, the nomination committee for the members of the board. That committee is separate from the government, and it makes recommendations that are independent of the government's views. And then the board members actually nominated, of course, are also independent. There are so two different layers of independence to protect the independence and the integrity of PSP. But as with all institutions, we expect PSP, as well as other organizations, to be mindful of the situation that we're now learning more about and to do what is right for themselves and for Canadians. And regarding the appointments of auditors, this is also an issue in which we will want to think carefully about. Again, respecting the integrity and the independence of that institution.
Thank you, Minister. Ian?
Ian Wood, CTV News. Minister, the PM this morning just reiterated that lots of money has already been given to provinces and territories to deal with the coronavirus pandemic. I'm just wondering, of that, I think, $1 billion, how much of it was earmarked for care homes? And considering this was done before the military raised the flag of issues in care homes, is more on the way?
Well, that's important to remind Canadians that indeed, from the very start of the crisis, the federal government did send a $500 million extra transfer to provinces and territories in the anticipation that there would be a need for greater resources invested in the broader health sector, including public health, but also including healthcare, and that includes the healthcare provided by long-term care centers. As we also know, the federal government has been providing, and that's absolutely necessary, support for personal protective equipment, personal for provision of treatment. We're working collaboratively on the development of vaccines. So there will be more to do. But as I said, from the very start, we did invest significantly in the crisis. How exactly those dollars were spent by provinces, of course, depend on the priorities of provinces, and that depends, of course, on the local circumstances of each province and territory.
Right, but just to clarify, the money was for the health sector and dealing with the pandemic, not specifically care homes. So is more on the way, essentially. That's what I'm asking. My second question, though, is a few weeks ago, we sat here and we heard about the government's plan for helping seniors who are struggling financially. Some people have said that they're not receiving those benefits yet. Do we have a date on a rollout? Has this already started? Are there any issues with getting this additional money to seniors?
No, there is no additional issue. We want to make sure that these benefits come quickly. We also want to make sure that they are allocated in a prudent and efficient manner. The system is remarkably effective, but since we're dealing with almost 7 million recipients of old age security and the guaranteed income supplement, public servants need to do their rigorous work, and we expect the delivery of those benefits to be done as quickly as possible.
One question, one follow-up, Ian. Okay, thank you. Mike?
Hello, Minister. I'm just trying to figure out who is actually responsible for these long-term care homes. We have auditors from the government. We have provincial people. We have local jurisdictions. There's everyone there. Who is responsible ultimately? If we were to go, we need this fixed. Who do we talk to?
Well, I think most Canadians, and including yourself, Mike, know that it's under provincial jurisdiction. What most Canadians that I know of also believe is that this is a joint responsibility at the end, that wherever the support comes from is less important than the importance of that support. And that's why Canadians expect, as Prime Minister repeated this morning, expect the federal government to be supportive of that provincial jurisdiction. It's true in all contexts, but it has become extremely clear to Canadians in the current context. What is happening to our seniors is unacceptable, and therefore the federal government's responsibility is to be there to support provinces and territories.
And this situation is probably not a new thing that just happened because of COVID. So it's probably been happening before this in some situations. Was there any indicators before these reports came out that these problems were happening in the long-term care homes?
Well, I'll perhaps provide a personal view, which may be too personal, view on that, given my role as a member of parliament. So during the last election, I did have the opportunity of visiting long-term care centres in my riding. What I saw was very good, meaning a lot of dedicated staff, people working under difficult circumstances, typically with a modest wage, very committed physically and mentally to their work. But what I did notice is that there was a lot of work to be done. Not only the physical work, but the psychological, the human presence, which was very demanding for the staff that I had the privilege of meeting during that election campaign. So it's not difficult for me to imagine how difficult that work must be now, and must have been now in the last few weeks, given the context that I saw in September. So although it was there, there was a feeling that there could be more time and resources allocated to look after our seniors. I think now it's clearly the case that we need to do more.
Thank you, Minister. So we're now going to go to the phone. One question, one follow-up. Operator, over to you.
Thank you. If you have a question, please press star 1 on your telephone keypad. Si vous avez une question, appuyez sur étoile 1. La première question est de Marie Vastel du Devoir. La parole est à vous.
Oui, bonjour, Monsieur Duclos.
Yes, Mr. Duclos. I'd like to come back to your encouraging words to employers to avail themselves of the wage subsidy so that folks leave behind the CERB and now turn to the CWS. Does the government intend to extend the CERB, or will it come to an end at the date originally indicated? Response. Well, you've just underscored the important link between the CERB and the CWS, the wage subsidy. We know that from the outset, with this pandemic, a lot of Canadians lost their jobs and therefore their source of income, and by extension companies had difficulty keeping them on their payroll. Now, we expected that a lot of those workers would claim the CERB, the Canada Emergency Response Benefit. Now that the economy is slowly starting to recover, and we can sense this particularly in Quebec, there are a lot of companies that want to sort of get back to something approximating what's normal, and we're expecting the CWS to replace the CERB in as many cases as possible. But what's important to understand is that under the CWS, wages continue to flow to employees, and that will help the employees, in fact, to contribute to the recovery of the businesses and, by extension, the Canadian economy. Now, we're obviously around the cabinet table and within government discussing these issues proactively, and in due course we'll have more specifics to offer you. Follow-up question? Yes, on another topic that you raised in English, assistance for seniors. Could you clarify when this money will come out of the door? And I know it's difficult to make verifications, but some of these seniors already receive the old age security. So I don't know why there would be additional delays, why it's not as simple as tacking on $300 to their pension checks. Why is there this delay? Response. Well, listen, I'll give you specifics. So everyone wants to know when this is going to happen, when the money will get out of the gate. We know that public servants and officials have to follow directives to ensure that the Canadian taxpayers' money goes to the right people. Now, the amount of money will be non-taxable, and of course applications have to be processed. There's a normal administrative process that needs to be followed so that things are done properly but also quickly. Thank you, Minister.
Merci. Thank you. The next question is from Teresa Wright, the Canadian Press. Please go ahead. Your line is now open.
Good morning. Earlier, the Prime Minister said he didn't want to make aggressive proposals to the provinces when we asked him about the idea of federal standards. Why would national standards for long-term care be considered an aggressive proposal?
Well, I think federal standards would be aggressive. National standards would be aggressive too if they were developed and then proposed in a manner that was dictated by Ottawa. We know how important the work of provinces and territories is in all contexts in healthcare. We know how difficult it is in the particular COVID-19 context. So a question of respect for not only their jurisdiction, but also their work is absolutely essential. And that's what the Prime Minister said again this morning. So we know that the federal support and federal guidelines or federal support to guidelines, that's good when it is developed in collaboration and in full support of the work of provinces and territories. Otherwise, we would engage into jurisdictional fights, and that would be completely counterproductive. We want that to be done for the benefit of seniors, and that's why it must be done in a very respectful manner.
Follow up.
Yes, thank you. I hear what you're saying, and yourself and the Prime Minister and others keep talking about these jurisdictional issues, but we're talking about really serious abuses against seniors, our parents, our grandparents. What do you say to Canadians who are watching this unfold, who might just see this as politicians pointing fingers at one another and saying, it's not my job?
Well, that's exactly what we want to avoid. We want politicians to point fingers at each other. We saw yesterday how Premier Ford and the Prime Minister demonstrated a very good sign of collaboration, respect for each other, but most importantly, aligned, as you also said, to the needs of seniors, to the fact that we need to look after them better. So I thought, and I believe that is shared by a number of other people. I thought that yesterday's demonstration of respect and collaboration at the same time by Premier Ford and the Prime Minister Trudeau was something of significantly supportive of hope for the future and hope of doing better for our seniors.
Thank you, Minister. Operator, next question, please.
Thank you. Merci. La prochaine question est de Louis Blouin de Radio-Canada. La parole est à vous.
Yes, Mr. Duclos. Listen, my question is not for the President of the Treasury Board, but for the Chief Economist. My question is about the CERB. You answered my colleague's question earlier. Here's my question. Is this program one that can come to an end overnight? We know that there is a deadline. It may be extended. What about a gradual winding down of the CERB response? Well, thank you very much for acknowledging the fact that there is an economic side to the work that I do, and it has been the case for the past couple of months and years. Now, vis-à-vis the CERB, it carries the word or the name emergency benefit because the employment insurance system just wasn't up to the task to help millions of Canadians. It would have taken years to pay out EI benefits to Canadians, even those who are entitled and qualified. So we needed a fast-tracked seamless system, and that was called the Canada Emergency Response Benefit. Now, right off the bat, it was announced that the CERB would lead to something else, a different iteration of it, or something else entirely. We don't know what that will look like yet, but we know that it will be an income support measure for households and families, but also an incentive for workers to go back to work. We are all mindful of the fact that so that the economic recovery plays out properly, there will be a need for a transition from CERB to something else. Follow-up question. Just to clarify, should we understand from your answer that we might have a hybrid CERB to incentivize the return to work? Second question, what about the economic recovery? What are your top priorities? And when can Canadians expect to see the broad brushstrokes of the economic recovery plan for Canada? Will it be this fall that it will be released? What's the kind of time frame? Response. Well, let me give you a two-pronged answer to that question. First, we are in what I categorize as the second phase of the economic crisis of COVID-19. The first stage had to do with the landing of the aircraft in the midst of a storm to make sure that our families, our seniors, that everyone was safe and sound. The second phase is to provide the protective and relief measures that are necessary, such as emergency benefits for both companies and for larger employers, the wage subsidy that is already playing an integral role to help our Canadian companies to pick themselves up and recover. Now, there's going to be a third phase, of course. We don't know exactly when and how the third phase will begin. It'll, of course, to a large part, depend on the health conditions and the landscape and backdrop there. But public health experts' advice needs to be followed, and there need to be workplace accommodations such that the hazards and risks of a likelihood of a second wave of infection, which would be very dangerous for Canadians and Canadian businesses. So the third phase will be a collaborative process with the provinces and territories as well.
Still at what we call the second phase of the COVID-19 economic crisis. The first phase when we landed the plane, the social and economic plane of our country, making sure that workers and families would land safely in the middle of a big storm, a big health storm, and then the second phase is to protect the plane and the passengers, the workers and the families, and we're doing that through the Canada Emergency Response Benefit, through the emergency loans, both to small businesses and large employers, and of course through the Canada Emergency Wage Subsidy, which is already preparing a large number of businesses in Canada, preparing them for relaunching the economy. But we're not there yet for the final stage, which will be a full relaunch of the economy that needs to wait a little for health indicators to be both stable and more predictable. That requires a lot of self-discipline on the part of Canadians so that we don't run the risk of entering into another peak of COVID-19. And that, as this third stage is prepared, we obviously need and want to work with provinces, territories, and municipalities.
Thank you, Minister. Operator, one last question, please.
Thank you. Merci. La prochaine question, Louis-Samuel Perron de La Presse. La parole est à vous.
Oui, bonjour, Monsieur Duclos.
Yes, thank you, Mr. Duclos. First, I'd like to hear your thoughts in French about your reaction to the Canadian Armed Forces report on Quebec, and what about the possibility of a national pan-Canadian inquiry on this serious matter? Response. Thank you very much. I did indeed read Quebec's report. Now, for those of you who read the report, you'll notice a couple of things. First, and most importantly, the remarkable level of collaboration between Canadian Armed Forces members and the staff on site in these long-term care facilities, including the managers. Now, the report speaks to a great deal of respect vis-à-vis this level of collaboration, given the difficult circumstances, that is between the military, young people with a tremendous work ethic, and also those staff within the centres themselves. Second observation, there's a whole slew of challenges, both in terms of management, personal protective equipment, moving people from one room to another without cross-contamination and understaffing. These are challenges that we're already well and truly aware of in Quebec and elsewhere, and the Quebec government is working hard on this. Now, the Canadian Armed Forces, in a collaborative effort, faced up to these three challenges: PPE, movement from one area to another in the long-term care facilities, etc. Now, these institutions are places where seniors live. They're not hospitals per se. When hospital care is required, well, then those seniors are transferred to hospitals. So basically, this living space was completely overhauled in the midst of this crisis. Now, the third thing that I observed from the report is a glimmer of hope, and there has been improvements, enhancements in the 25 long-term care facilities, and part of that improvement is thanks to the presence of the Canadian Armed Forces, both in the 25 long-term care facilities and in other facilities for the care of seniors. Now, the pressure in some long-term care facilities was reduced by virtue of the fact that others picked up the slack, and technicians and nurses in some long-term care facilities were relieved by the military so that they could go to other centres and work. And I noted that in the report. Follow-up question. I also asked about what your thoughts were about the possibility of a commission of inquiry. And a second part to my question, commercial rent subsidy. How many employers have signed up for that program? Was it a successful program? And do you expect more employers to apply? Well, response to your first question. Mr. Trudeau responds to this question often. We always endeavour to go about things collaboratively with the provinces and territories. We don't want to ride roughshod over their areas of jurisdiction, infringe or encroach on them. We know that they've had difficult circumstances that they've had to grapple with over the past weeks and months. And your second question was? Yes, the commercial rent. Response. Such good questions that I forgot what you asked. Well, as far as the commercial lease program is concerned, I don't have any up-to-date statistics at hand, but as of yesterday and the day before yesterday, claims for this benefit were only made for a handful of premises. So we're going to wait a little bit longer before we develop a helpful or useful record or toll of employers who are asking for a part of their rent to be, in fact, waived for the short term. Thank you, Minister. This is the end of this press conference.